It means COVID has not gone away. The numbers have come down definitely, but COVID has gone nowhere. 27th of January is just last week, and we had lost 659 people to COVID 19, which is 4.1% of all deaths that happened in the UK. This definitely is a decrease from 882 people who lost their lives in the previous week, and which was 4.9% of all the deaths that happened in UK. If I come back just to the statistics of England, how does it look like? Well, it looks like this. There were 545 deaths which were due to COVID 19. Now, has been registered on 27th of January 2023, which is again last week. The week prior to that had seen 711 deaths due to COVID 19 just in England. So, COVID keeps working its havoc on us, on humankind in the UK, which includes England, Wales, Northern Ireland, Scotland. And what can we do about it? We can become more aware. We can take vaccines on time, repeat vaccination, and keep ourselves and our loved ones safe. To know more about this and how different communities have coped with COVID 19 since 2020, I have a very special guest with me, Dr. Ugochukwu Stephanie. I want to take Dr. Ugochukwu on our line. So, hello, Doctor. Firstly, thank you for being on my show. And I'm sure that you will enlighten us with the present status of COVID 19 in the UK, what we can do about it, how has different communities reacted to the vaccination that has come out? Are the vaccines worthy? What are the components in the vaccines? Do we still need to take it because we know that we need to repeat vaccination? How long is it going to go that we need to keep taking vaccines? Is it more like the flu vaccination, which needs to be taken every year? What is the status? What is the statistics? I would like to know all about that from you. But before anything, Doctor, I would request you to introduce yourselves to our listeners.
Hello, Annu. Thank you for
Doctor,
inviting.
I don't think I can hear you. You will
Hello,
need to
Annu.
unmute yourself, I think. Okay, here you go. Can you please talk?
Yeah. Hello, Annu. Thank you
Yes,
for
thank you.
inviting me to your show. It's a pleasure to be with you this evening. My name is Dr. Ugochukwu Stephanie Lgwe, and I'm a medical practitioner specializing in pharmaceutical medicine. I've worked in the NHS before I moved to the industries for about 5 years, where I worked. I'm a physician with the general medicine. Before I now moved to the industries, where I work as an investigator. So I deal with the development of new drugs. So that is my area of specialty. So it's really a pleasure to be with you this evening, and I hope that I will help impact your audience with some knowledge about COVID and what is going on. Thank you.
Thank you, Doctor. That was a wonderful introduction. It was really interesting to know that you have been a part of the pharmaceutical industry. And from there, you bring to us uh, your hands-on experience from how medicines are developed, how they work on people, what are the tests that are done, how much, how what is the expense of the test that's done on humans before any vaccine or any medication is
Yes.
implemented on the society, all about that. So it's my pleasure to have you on my show just again. So
Thank you.
Dr. Vichukwu, there's this question coming up regarding disproportionately impact disproportionate impact of COVID-19 on the humankind. Now, as we see in the UK, the statistics tells us that COVID-19 has disproportionately affected the Black and the South Asian community.
Absolutely.
So, how much is there truth in this statement? And if it has affected people from the Black and South Asian communities disproportionately, how do you look at it? What needs to be done? Would you please explain?
Okay. So there are data that did show that the people of the Black and Asian community were disproportionately affected during the COVID. And this was measured in terms of the number of deaths per 100,000. And it was also based on what is the sex of the individuals, with male and female, and the effect of that. But overall, when you count the number of deaths, overall, the people that death did affect more the Caucasian population as overall. But when you come to the statistics in terms of the age limit, so we're talking about younger age, people that are less than 60, below the age of 60, it impacted more of the Black and Asian population. And there are so many risk factors that contributed to that. So one of the most important of that risk factors is that when this has been analyzed, you found out that when you come to the healthcare profession, these are the people that actually came in contact with people with COVID, the frontline workers in our NHS hospitals and in the community. Now, when you look at the cadre of employment, so you find out that overall in NHS, you do have the white population more in number of the employees of NHS. However, the people that are the frontline workers, the low grade, like the junior doctors, the nurses, and other healthcare workers that do the medium to lower end of the job and actually have contact with the patients are more of the Black and ethnic minorities, whereas the senior staff members and those in the administrative level are more of the white. So that actually contributed to the number of deaths that we're seeing in the minority, the Black and the Asian community. And as you may know, of course, COVID had a more worse outcome for people with comorbidities. So comorbidities means people with other health problems. And there are some health problems that causes more poorer outcome than others. So things like diabetes, things like hypertension or high blood pressure, obesity, and kidney diseases. So you find out that the people, especially the Black community, you do have a lot more of them that are diabetic and are hypertensive as well. So these were also a contributory factor. Now, when you come to the socio-economic level of people in the UK, there's a data that shows that people that lived in area where you have more of overcrowding or overcrowded families also do have worse outcome. And this also impacted the people of the Black and Asian ethnic minority. So,
Doctor, I'll have to take this break. It is a commercial break which needs to be taken, but we'll continue with this discussion, and I'll allow you to explain this to the people. But before that, a commercial break.
okay.
Commercial break. commercial break नहीं जा रहा है इसमें
आपकी आवाज कट रही है, so keep distance.
That should be
All
correct.
your आवाज is blasting. Hmm?
That should-
Your voice is blasting, so keep some distance.
Hmm.
Now you know कि कौन कौन सा ऊपर करना है. उसको पीसी को भी ऊपर करना है ताकि उसकी आवाज रखने के लिए जाए.
Restaurant, Derby, call us on 01 332 340 666. Bring your family and friends to Ahmad Restaurant. Ahmad Restaurant, come for the taste, stay for the taste. Be there, be there.
Hello.
Hello. Can you
Yes,
hear
Doctor.
me?
Yes, Doctor, the advertisements are going on. I would request you that we will need to wind up real quick. I'll take many questions. So,
Okay.
in the next half, yes, we'll have to be quick.
और हमारा स्टेज कितना दिलकश था कि सब देखते ही रह गए। मुझे तो बड़े तुम साइन और सेंट पीसेस बहुत पसंद आए, इतने यूनिक थे ना। हाँ, और वलीमा तो सबसे ज्यादा याद आया। हाँ, मगर मुझे तो मेहंदी और बारात की डेकोरेशन सबसे ज्यादा पसंद है। सब ख्वाब जैसा था। मगर इसे हकीकत बनाया। हयात में हमारी शादी को चार चार लगा दी। रिव्यूज देना तो बनते हैं ना। अभी कॉल करें 67715227977 या फिर विजिट करें hayatlinks.co.uk।
Hello and welcome back to Healthy Discussions with Anu. We were discussing COVID 19. COVID 19 has gone nowhere. Yes, we are not yet rid of COVID 19. With me, I have Dr. Ugochukwu Stephanie. She was giving us important insight into what's going on in the UK with COVID 19. I already told you that we still are losing people in the UK from COVID 19. So, vaccination becomes a must. Dr. Ugochukwu, who herself is from the pharmaceutical industry and is now serving the NHS, is giving us insight on how we may protect ourselves and the community from COVID 19. Dr. Ugochukwu, we were discussing about COVID 19. You were telling us about the disproportionate impact of COVID 19 on the Asian minorities, South Asian minorities, and the Black people. Having said that, I will take this discussion to a different direction now. We have around 26 minutes
Yeah.
to discuss all this, so I'll quickly take it to a few different directions and we'll ask a few questions that we want to know about at this point of time. Firstly, in the UK, when vaccines were introduced, three vaccines were approved by NHS. What is the status as of now? How many vaccines are approved by NHS?
So at the moment, we have 6 vaccines that are approved.
Yes,
However,
would you kindly name them, please?
yes, so you have the Moderna, which is called Spikevax. You have the Pfizer BioNTech, is also known as the Comirnaty. You also have the Novavax. Then you have the AstraZeneca vaccine. This is the vaccine that was produced by AstraZeneca and Oxford University. Then you have the Johnson, which is produced by the Johnson and Johnson vaccine. And then you have the Valneva vaccine. However, it's only three that is available at the moment. And the ones that are available, the Moderna, the Pfizer vaccine, and the Novavax. These are the three vaccines that
All
are
right.
available.
And are the components of all these vaccines similar, different? Should the people know about it? Should they be scared about it? Because there is a lot of conspiracy theory around it. That has been one reason why not everyone, even in the UK, has taken the vaccination, or some people have taken the first few and have not taken the boosters because they have felt some kind of reaction and they think that the reaction is due to the vaccination. Would you kindly help break this conspiracy theory and their understanding of COVID vaccines, please?
So just to make it clear, before any drug is given to man, it goes through a lot of testing. And the good thing is that when COVID came, it was a global problem. And because of that, a lot of people and a lot of organizations came together to ensure that vaccine was produced. I know I'm saying this because some of the conspiracy is that, oh, the vaccine was produced quite quickly compared to the number of years that it takes to bring a
Yes.
drug to the market. But this is because there was a collaborative effort from industries, from other research institutions, from universities. And so a lot of scientists actually came together, brought their talents together, and it was prioritized in terms of approval. So data were generated and a lot of people volunteered to thousands and thousands of people actually volunteered to take part in the trials. So that was why it was produced fast. It's not because there is any safety thing that was compromised. It was just because the collaborative
Right.
effort, so many people were actually involved, and it was kind of prioritized because it was a major health challenge worldwide. So
Exactly.
um, it's just for people to understand all the due diligence that were supposed to be done were actually done for these vaccines. And yes, we do have some of the vaccines do have a new technology that has been actually tested for years, but were incorporated into this vaccine. And that doesn't mean that it does not actually have any other special safety problems because it's a new technology. As I said, it's a technology that has been known for a number of years, but it was used for this particular vaccine. And people do tend to have, sometimes there are some things that is in our head. And when things happen to you, feel, oh, this might be a vaccine. To be clear, every drug that is in the market has a side effect. So,
Right. Yes. But I would like to intrude here and ask another question. COVID is the same way, it's the same virus which causes in a different form actually. It causes SARS and Ebola.
yeah,
It is COVID, but not COVID-19 obviously, which
it's
caused
not,
this.
yeah. So,
Yeah,
COVID
a
19
different
is a
variant.
special strain of that virus.
Yes, yes. But vaccines for Ebola and SARS are not yet invented. If I'm not wrong.
So, there are some effort into the vaccine for Ebola, but
Okay.
is not yet marketed. There's no full-blown vaccine for
Yes,
Ebola.
and for SARS, do we have anything for SARS?
For SARS, I'm not very sure whether we have a vaccine for SARS.
Yes,
I
so
don't
this
think
is the area where people start questioning
so.
if
Wonder.
Ebola and SARS, which has been around for many years now, although we now know that COVID has also been there amongst humanity for a long time. The question is if these ailments have been there these viruses have been there, and yet the vaccination never came out because there was no pandemic. There was only epidemic
Yeah,
with SARS or Ebola, which could be contained. And now that with COVID-19, there was this pandemic and it was a global crisis,
absolutely.
vaccines came out really fast. It looked like, at a fiery pace, this was developed in different parts of the world. Vaccines were given, everything brought to control. Why could one not do this for Ebola or SARS, where we have the same kind of, death rate, if not more? So I mean, when even
You
knowledgeable people read this, think about it, they are in question. How? Why? These are the questions. So would you help,
you've
help me
actually
understand?
mentioned, yeah, you've actually mentioned the key thing. So this is a pandemic, and the SARS, the Ebola, was an epidemic. And the thing is that COVID affected this pandemic because it's worldwide.
Yes.
So, and as you can see, because it is worldwide, it affected globally a lot of, it had economic impact, it had health impact, it has social impact.
Mm-hmm.
So because of those impact, it's actually kind of put the world, shut the world down, if I can put it that way.
Mm-hmm.
So that is why it was prioritized, and because it had a global impact, so more people were actually more interested, and that is why the collaborative effort actually was more successful, because more people were interested, because it was impacting severely the functionality of the entire world.
So we
So
must understand that it was because the whole world came together and put their efforts into it. Financial and human efforts were put into it. Volunteers came in and volunteered for themselves, tested. I mean, to be used as the for the medicine to be tested on them. They volunteered. Huge number of people came forward for the vaccines to be tested on them. All of this being brought together, we had a much quicker response,
we
and
have more
vaccines were
absolutely,
developed much quickly. Right. So
absolutely.
there is no kind of conspiracy around it. These
There's
are
no
very safe and need to be taken. Yes.
Absolutely. So
Now,
there's no conspiracy. That's the word.
okay. Now, if vaccines are being taken regularly, why is it that we still see death due to COVID-19?
So
Why is it that we are not seeing that, okay, people are falling ill to COVID-19 and then they are recovering from that, going back home? Why is it that we are still seeing people dying in numbers like even this last week, 27th of January, the report of 27th January 2023, we have lost 659 people to COVID-19. If vaccines are very effective, if we are, I mean, people are taking vaccines, booster doses are being taken, why are we losing them? I mean,
I will give you,
statistics says the number is coming down, yet we are not rid of it. How
yeah.
so?
So I will use a very similar example. So flu. So during the
Mm-hmm.
winter season, flu affects a lot of
Mm-hmm.
people. And we have yearly flu
Right.
vaccination for healthcare workers, for people with respiratory
Okay.
comorbidities, for elderly people, people that we think are vulnerable. So if you check the statistics, you will know the flu has been with us for ages and is still killing people. So it's the same or similar thing with COVID. So
Mm.
COVID has actually come to stay. It's a respiratory infection, it's an infection. And from time to time, it will come, you will have it. So, but the best thing is, it is clear and you can see evidently that the impact of COVID has drastically reduced since the mass vaccination. So that is the one reason that you will know that actually the vaccine is working and has actually done a good job. It's the same way that it applies that we give flu vaccine to people that are vulnerable. So in terms of people dying, this should be expected from time to time, because another thing we need to look at, what is the statistics of these people that are dying? It's likely the people that have low immunity, maybe chronic illnesses, or the elderly and are frail, or people with other respiratory um, problems. So when you look at the data and the real statistics, you're not having most of the young people dying as when we had the overwhelming death rate in 2020, So that is what is going on. I think people has a misconception that COVID is something that we can easily eradicate, but it's a virus that have been introduced to man, and it might be with us for a long while. And that is why we
So
keep
for our
advising.
listeners, you must understand that COVID is not going away anywhere, just like flu, which has been with humankind for all these years. And the only way
Yes,
to prevent yourself from flu is by taking vaccination.
vaccine.
Similarly, COVID has been introduced to the humankind, and we can only and only fight against COVID-19 by
Prevent it.
taking vaccines. And these
Yeah.
vaccines have been tested on numerous human beings who volunteered themselves for the test, and they are very safe. There are multiple different kinds of vaccines produced by different pharmaceutical industries across the globe, even in UK. As Dr. Ugochukwu already told us, there are 6 different kinds of vaccines, although the NHS is now recommending 3 of them, and they are being given regularly. Doctor, give me another data, if you may, please. Um, what age group at present is being affected by COVID-19 the most?
So the age group that is being affected the most at the last time was actually the young people. And
Oh,
when you say affected, these are people that actually get the infection. But the age group that have a poor outcome like death is mostly the elderly, the
okay.
vulnerable, and people with comorbidities.
Okay.
So,
So this gives us a clear picture that the young are the carrier
yeah,
and the old are the ones who are losing lives. And this
absolutely.
is a question to the community. Are we really going to do this to our elderly people, to our loved ones? Where is our responsibility towards community? What is our responsibility towards our society? To protect the vulnerable, to protect the newborn, to protect the elderly, to give them a healthy, long life. And for that, I think we cannot do anything but think wise, step properly into the right direction. And what would be the right direction, doctor?
So the right direction is, if vaccine is offered to you, go get the vaccine. One, you're protecting yourself and you're protecting the society and you're protecting your family members. And as you rightly said, Anu, you are protecting your elderly grandmas and grandpas that are at home. So it is very important.
And
You're
also
also
probably the newborns, the
the
newborn.
newborns and the pregnant women as well.
Yes,
So,
yes.
the importance of this cannot be overemphasized. And as I said, and as you've also mentioned, vaccine has been rolled out worldwide. And we know that it's been well tolerated and is safe. So people may have some side effects, but those side effects are things that are actually expected, because if you get other vaccines like the flu vaccine, you do feel some of these things that people complain about, or maybe you have some muscle ache, maybe mild fever, maybe aches and pains or swelling, or weakness of the arm where you had the injection. These are things that are quite common, and is they are not new. However, if you have any serious illness, you can always contact your GP. As I said, there are all medications, people react differently. But what is checked is what is the benefit and the risk of that medication. And the vaccine is approved and being advised to take it because the benefits exceeds the risk.
Wonderful. Now I have 10 minutes in hand. I'll take this discussion to another, direction once again. And this time I'll focus it completely on the community that we work towards, the community which, we cater to, which is the South Asian community. We can even talk about the Black and the other minorities where the South Asian community falls. Doctor, we started our discussion with this, the disparity of COVID's impact on the Black and minority or the South Asian community. Now I come specifically to this question. How much vaccination has been absorbed by the South Asian community? Did they reject the vaccination to a certain extent? If so, what has been the impact? Or did they react much positively? And just because they have bigger families, COVID has impacted them more. What is the scenario? What do you see from your chair? What do you see from your, your place? How do you see it? And what is NHS doing towards it?
I think the major effect is that people did reject the vaccine. People were quite skeptical. People within this community were quite skeptical taking the vaccine.
Okay.
And what the NHS have done, which is part of what you're doing now, is this campaign. And they had to involve some of the healthcare professionals from this community to speak to their people. Because sometimes this is something that has to do with trust. And when you're getting an information from someone that you think is the same as you, it makes more sense and more meaning. So that is why this campaign is going on, and is also going on in the Black community. And so many people are being getting involved, including some religious leaders as well. So
Mhm.
this is what NHS is doing. And I think this campaign has actually helped because it has improved in the level of acceptance into this community. So it is something that is encouraged that we keep campaigning, especially as people are being offered booster vaccine. And there are some group of people that might require yearly booster. So we need to keep on the campaign to allow people to be more accepted to having the vaccine.
Okay. So now narrowing it down, narrowing down the discussion to just Nottingham. How do you see COVID-19 impacting Nottingham? Because Nottingham has a huge population of South Asians and other Caribbeans. So it's a black and other minorities. We have a huge population here. How do you see it? How has Nottingham reacted to it?
So initially, I did talk about overcrowding.
Mm-hmm.
So overcrowding is part of the risk factors that is established that will impact a poorer outcome of people that have COVID.
Mm-hmm.
So, given the social and also the socio-economic level as well, so people with a poorer socio-economic um, status will also have a poorer outcome. And the ethnic minority being kind of averse to the vaccine will also affect how the impact of COVID will affect the community. I'm not very sure how Nottingham has actually accepted this, or whether they have a higher number of people
Mm-hmm.
who have actually refused to take the vaccine. But the characteristic of this socioeconomic level, the
Mm-hmm.
overcrowding, is something that will impact them and give them more a poor outcome if they have COVID. So
Okay.
it would be quite
Dr.
beneficial.
Intervening here, would you please explain overcrowding? What do we mean by overcrowding? Is it overcrowding when you're outside, whether it is
No.
crowding at home? I think we need to define this once again.
Yeah. So overcrowding means the number of people that live in an apartment or a house. So that if the number of people living in a house is more than expected or appropriate for that. Say, for example, a one-bedroom house
Mhm.
is expected to inhabit a couple, which is two people, or two siblings of different age, maybe a male and female child that is between the ages of 10 and below. That is appropriate.
Okay.
Or two, um, two people of the same sex living in a room. That is appropriate. So, in this instance, you may see more than this number of people I've mentioned occupying a room. That is overcrowding. So, I don't mean when you go outside or you go to a crowded party No, I'm talking about the living conditions now.
Living conditions. So you mean to say, due to overcrowding or due to more number of people living in a certain space inside, within your home, within your household, COVID can impact you adversely because you are more susceptible to taking the virus or being affected
And
by the virus,
spreading it easier.
spreading the virus.
Yeah.
Yes, because you are too close to each other or there are more number of people. Again, it is. It would be wise to say, if you're not very conscious, if you're not very aware, if you are not, you know, well, I should say awareness towards community, towards your society, towards the people outside. If you think you have some kind of a symptom, it's best to check and then to go out rather than bringing everyone or putting everyone's life at stake. We do not know when we walk past who is vulnerable or has some kind of some kind of a disease which can be aggravated just because we are not being conscious or cautious or kind enough, if I may say so. Yes, there goes this idea of being kind. Kindness is not just by giving to the needy, it is also by protecting others. Loving is not by just by showing love, it's also by caring for them without having said a word, just by your behavior. And this means a lot. Third and most important, going by the regulations that we are being asked to follow. Now, NHS at present has a few regulations put forth. Doctor, would you kindly elaborate? I have just 3 minutes left in which I'll have to end this show. Would you kindly quickly tell me what are the regulations put by the NHS at present, put forth by NHS, which needs to be followed by every citizen of the country or every person living in the country?
So, one, we do know that the restrictions that we had initially has been relaxed. However, you are advised, if you have symptoms, please, if you can afford to stay indoors, do stay indoors, because you should try to protect the community, your family, and other people. And if you must go outside, please have a face covering like mask. And also, the normal hygiene of regular hand washing, sneezing into a tissue, it still stands. I know that now it's not legally binding, but it is an advice. So, to protect your community and protect your neighbors, it is still good to practice those necessary hygiene that
Mhm.
we were practicing before. But the
So,
most
washing your hands,
important thing,
yes, washing your hands, keeping away from others if you are feeling unwell or if you have
yeah,
symptoms, wearing your mask,
mask.
hand sanitization, or washing your hands, all this is still there. Not, you're not forced to do this, but well, if you're a good citizen, you will do it by yourself. And most of us are real good citizens, and we should think wisely and act wisely to save the community. Last but not the least, you have already talked about the side effects of vaccination, but because we are requesting people to be aware, if you have been sent a message or have been informed by the NHS to take your next dose of vaccine, whether it is a booster dose, whether you have missed out on something, uh, you should take that seriously. If you are not very confident, you can talk to your GP. Now, here, doctor, my last, request to you would be, would you say side effects are detrimental, or would there be a fatal side effect on anyone if they took this vaccine?
That's a very difficult question. So the side effects of all the vaccine is well established. As I said, there are some side effects, like something like
But
anaphylaxis, that is quite
yes, but
severe,
that's not
but
detrimental.
that is not, it is very, very, very rare.
Very, very rare.
So,
Okay. Having
but
said
what I
this,
will,
I'll need to bring this show to an end. It is time for our commercial break. We had a wonderful chat with Dr. Ugochukwu, thank you, doctor. You have enlightened us just again. We understand COVID is not going away anywhere. We have to be aware, we have to be cautious, we have to keep ourselves safe and keep our loved ones safe and keep the community safe. So we take up the responsibility of taking the vaccination. NHS is making us aware of this. So here's saying, a good evening and spend the rest of the evening safely inside or outside. Enjoy your time and think about it. Just give one little thought about this vaccination. Dr. Ugochukwu has already explained much of it. She has explained how the vaccines work and how they have been made, why they have been made so quickly, what are the side effects, and we have discussed it enough. Not taking any more time off you. Here saying a goodbye from Healthy Discussions and from Anu.
Thank you.